Hi, my name is Dr. Eric Janowitz. I'm the founder and clinic director here at Synergy Oviedo Chiropractic. We have had the privilege of serving this community for well over 20 years and over 20,000 patients. But the most important patient we have today is you, so I want to welcome you to our clinic. Now, many of you have never been to a chiropractor before or are coming back to chiropractic for some time, and I always want to take a step back to explain what we're going to cover today. So as a chiropractor, we work with the spine and the nervous system because the spine has two functions. Number one, the spine is going to support you, which of course is your posture. The second thing the spine does is it protects the delicate nerves. Let me show you how. So how your body works is the brain controls the healing of the entire body. It does it by sending messages down the spine, which goes out to the muscles in your back, but they can also go to the muscles in your neck and even up towards your head, or even down into your arms or down into your legs as well. In addition, the nerves also feed and give energy to every single internal organ as well. So every organ, cell, and tissue in your body is totally dependent upon that energy to keep you healthy and alive and strong. And so, for example, the nerves in your lower back, they send strength and energy to your bowel, bladder, and sex organs. In the mid-back, it can affect your stomach. In your upper back, it can affect your heart and your lungs. And in your neck, it can affect your thyroid glands of your immune system, and even going up to the sinuses, eyes, ears, nose, and throat. So there is a lot of areas in your body that can be positively impacted through really good nerve energy in your body. Now, what can go wrong? Because of different stresses, which can happen something sudden, like a car accident, a fall, or a trauma, or repetitive things over time, like poor posture, backpacks, cell phones, computer usage, all these areas, that can cause the bones in the spine to shift out of position. Now that shifting is called subluxation, or misalignment for short. Now, based upon a review of your intake form, our doctors determined that you also have the possibility of having subluxation complicated by a disc problem, which could be a disc bulge or disc herniation. What gives us a clue about that? Well, the fact that you're having some sort of lower extremity issue or upper extremity issue, or you've mentioned that you have a disc issue from a prior study as well. Now, when you have that, that's a very serious and very concerning issue that we have to take care of very appropriately. So our office over the past 20 years have become experts at treating misalignment complicated by disc issues. One of the advanced technologies that your doctor will be talking to you about today is something called spinal decompression therapy. Now, we have patients that have come from all over the world, in fact, to our practice here in Oviedo to get help with complications from disc problems. So aside from chiropractic, if this is not worked with decompression, the next step is a medical doctor might look at doing things like oral pain medicine or anti-inflammatories or steroid dose packs. The next level of that is injections, which are like epidurals, or potentially spinal surgery. And I think we all can agree that if we can avoid surgery, it will be a much better way to enable us to live healthy and strong throughout our life. So your doctor is going to be coming in here doing a very thorough evaluation, a thorough history, looking at your posture, looking for signs of misalignment complicated by disc issues, and rest assured, if we do find those, we have a very comprehensive plan that has been successful for hundreds of people throughout the course of our treatment here. We look forward to serving you, and your doctor will be in here in just a moment. Thank you.